The advantages of IVF treatment is that because there's more than the one egg and hopefully more than the one embryo, there's a lot of selection. Embryo selection helps success because we are then able to select an embryo which is likely to give you the best chance of getting pregnant. The downside is that it involves taking medication if you're having stimulated IVF treatment. There's the risk of the egg retrieval procedure and the side effects of the medication. The risks of the egg retrieval procedure involve some bleeding post-procedure, which is likely to settle in a few days' time, risk of infection for which we would give you antibiotics, risk of injury to internal organs like bladder, blood vessels and bowel. Having said that, because the procedure is done under ultrasound guidance, the risk of that happening is extremely slim. It's less than 5%. And even if it did happen, usually nothing needs to be done because it's only a needle stick injury. Then is the more serious risk, what we call ovarian hyperstimulation syndrome. Now, this is a condition which can happen in women who are young and who have very active ovaries. It's a very serious complication and one that we don't take very lightly at all. If we were to find that you were someone who's at risk, we would take measures right from the onset, right from the start of your stimulation. What happens in ovarian hyperstimulation is that women start over-responding to the stimulating drugs. They may start feeling very bloated, start being sick, and lose fluid through diarrhea. When one is dehydrated, one is at risk of blood clots, which can travel into the brain, into the heart, into the lungs, and that condition is extremely serious and it's a medical emergency. Now, if whilst we're monitoring you, we felt you are someone who is developing ovarian hyperstimulation, then we would either have to reduce your dose of stimulation or stop the stimulation altogether. Once your body had recovered, we would then resume stimulation or put you down for the egg retrieval procedure. Usually, once one has had the egg retrieval and we've then subsequently monitored, if these symptoms have settled down and are of a mild nature, we may be in a position to proceed with the embryo transfer. The reason for trying to assess this is that when one gets pregnant, these symptoms can get a lot worse. And hence, if we have any worry that pregnancy would further increase your risk of ovarian hyperstimulation, then in that situation, we may have to freeze all your embryos with a plan of allowing your body to settle and recover from these side effects. The final risk is multiple pregnancy. Multiple pregnancy is a risk of IVF treatment whereby more than one embryo is put back. In that situation, there's a higher risk of miscarriage, higher risk of problems in the pregnancy such as high blood pressure, diabetes. The pregnancy tends to be shorter in duration, so the risk of preterm delivery and of course children who are born before the full term are more likely to have neonatal infections and have complications because of prematurity. Again, how many embryos are suitable to be put back depends on the quality and number of embryos you have and your previous treatment history. That plan is made on the day of embryo transfer. You will be in a situation to decide along with us as to whether you should have just one embryo or two embryos put back.